Bismillahirrahmanirrahim. So students, today we are going to discuss the basically mediastinum. But for mediastinum, first we will have to see the thoracic cage, that how thoracic cage is formed. So we all know that thoracic cage is formed in the central part by the sternum. So this is the sternum anteriorly, and then on each side there is the costal cartilages along with their ribs, and posteriorly then we have the thoracic vertebrae, right? So these are the thoracic vertebrae. So these forms the thoracic cage, and in the thoracic cage, if we see, this is the whole thoracic cage internally, and these on each side are occupied by the pleural cavities, right, with their, which contains the pleura with their lungs. And in the middle part, it is there is a space is left. That space in the median partition is known as the mediastinum. So if we see the internal aspect of the thoracic cage, we have removed the whole osteo part of the thoracic cage. Now we are inside of the the thoracic cage. So we see that on each side it is occupied by the lungs, and in the middle portion we are left with the space which is known as mediastinum. Now mediastinum is occupied by the important structures, like we have the visceras like heart, and we have the trachea, we can see trachea over here, we cannot see esophagus in this part, we can see the important arteries and veins. So these all are occupied within the mediastinum. Now if we see for the descriptive purpose, mediastinum is divided into two parts, right? The superior mediastinum and the inferior mediastinum. If we talk about the boundaries of the mediastinum, there is an imaginary plane which is passing from the sternal angle. So we know that sternal angle where the manubrium sterni meets with the body of the sternum is known as the sternal angle, right? So this plane, imaginary plane passing from the sternal angle anteriorly, and it goes posteriorly till the fourth thoracic vertebrae, and this forms the cutoff point between the superior mediastinum and the inferior mediastinum. Now talking about the boundaries of the superior mediastinum, so we can see that here it is anteriorly it is bounded by the manubrium sterni, and on each side there is the first rib with their costal cartilage, and posteriorly we have the body of the lower aspect of the first thoracic vertebrae, right? And then if we move superiorly, we can see that there is superior thoracic aperture, right? Now superior thoracic aperture, we can see that there is manubrium sterni, and on each side by the first ribs. And inferiorly, definitely that imaginary plane which is passing through, which is also known as thoracic plane, which I explained earlier. So this forms the boundaries of the superior mediastinum, right? Now contents of the superior mediastinum, if we talk about contents of the superior mediastinum, so we have the trachea in the superior mediastinum, right? We have different muscles, and then we have the arteries like the arch of the aorta that is arising from the heart, and then there are the veins, right? We cannot see the nerves, that includes the vagus nerve and the phrenic nerve, and yes, thymus and the thoracic duct, that is also not appreciable in this model, in this torso. But these are the contents of the superior mediastinum, right? And then coming to the inferior mediastinum. Inferior mediastinum is divided. Now this part is till the diaphragm. If we see over here, if we remove the liver, we can see, we can appreciate the domes of the diaphragm over here, right? This forms the inferior margin of the mediastinum, right? So the domes of the diaphragm form the inferior margin of the mediastinum. Now inferior mediastinum is again divided into, because of this presence of the heart and pericardium around here, it is inferior mediastinum is divided into anterior part, which is very narrow space. Then this part is the middle mediastinum along with the pericardium, and then if we remove the heart, posteriorly there is the posterior mediastinum, right? So now the anterior mediastinum, it is a narrow space in front of the pericardium. Boundaries of the inferior mediastinum: anteriorly there is body of sternum, and posteriorly definitely we will be having the pericardium, so it forms a very narrow space, and superiorly that imaginary line which is known as the thoracic plane passing through the sternal angle, and definitely inferiorly the diaphragm, right? So the contents of the, and then the middle mediastinum, which is occupied by the pericardium, right? Heart is enclosed within the pericardium, and then the ascending aorta, which is arising from the heart, right? And the superior vena cava, we can see over here, this is the superior vena cava, which is formed by the union of right and left brachiocephalic vein, and there is trachea, bifurcation of the trachea. If remove the this is the bifurcation of the trachea. So these forms the middle mediastinum. So this is now if the cadaveric specimen, right? So basically we can appreciate the chest wall, we can see the ribs and the intercostal muscles, and anteriorly we can view the mediastinal part, right, which is occupied by the different visceras, and here is the diaphragm, so which forms the inferior margin of the mediastinum, right? So we will see the different structures that are present in the mediastinum. Over here we can see this is the trachea, which have ring-like structures, and then we can see the heart along with its covering, which is the pericardium, and the heart with the pericardium is the content of middle mediastinum, and we can see this is the pulmonary trunk and the arch of aorta over here, and this arch of aorta then it continues to become the descending thoracic aorta, which is a content of our posterior mediastinum. Along with the arch of aorta, we can see that this is the inferior vena cava again, which is the content of the posterior mediastinum, right? Trachea and esophagus, these are the contents of the superior mediastinum, as well as they also are the contents of the posterior mediastinum. We all know that heart is a muscular conical organ, and this is the anatomical position of the heart. Like in the way that it is placed, 1/3 of it is placed on the right side of the median plane, and 2/3 of it is placed on the left side of the median plane. And it has got, we all know that it has 4 chambers. The 2 atria, this is the right atrium and the left atrium, and then the ventricles, the right ventricle and the left ventricle. Okay, and this heart has got the certain boundaries and surfaces. and its apex, which is formed by the left ventricle, this is the apex of the heart, which is directed downward, forward and to the left, right? And base, which is present on the posterior surface. This is the base which is present on the posterior surface, and it's directed downward, right? If we place it like this in the mediastinum, like if you see in the placement of the heart, you can appreciate that this left side, left ventricle, it is more towards on the left side, and we can see the apex as well, which is present at the 5th intercostal space, right? And so we have talked about the apex, we have talked about the base. The base is formed by the left atrium, okay, and apex is formed by the left ventricle. So now we are coming to the borders. It has got 3 borders, right? There is a right border over here, which is, if we see, which is vertical, and this right border is formed by the right atrium, and then we have this upper border, which is bit oblique, and if we see anteriorly, it is basically occupied by the pulmonary trunk and this aorta, arch of aorta, and we can appreciate faintly of it posteriorly. So it is formed by the upper border is formed by the left atrium and partly by the right atrium. So, and then there is the inferior border, or this is the inferior border, right? So which is formed by mainly by the left ventricle and partly by the left atrium or auricle, right? So we have seen the 3 borders, the right border, the upper border and inferior border, which is horizontal. And then the surfaces. This whole is the anterior surface, because it comes in contact with the sternum, it is also, and the costal cartilages. So these surfaces is also known as the sternocostal surface. This is formed by both the ventricles, the right ventricle and the left ventricle. Then if we rotate the heart, inferiorly, there is the diaphragmatic surface, which basically rests upon the diaphragm. So that is why it is known as the diaphragmatic surface. And if we see, it is formed by mainly by the left ventricle and part of the this is the right ventricle. Okay, so we have discussed the 3 borders and the surfaces, 2 surfaces, sternocostal surface and rotating the heart, inferior or diaphragmatic surface, and then there is the left surface, which is formed by the left ventricle and partly by the left auricle. So we are done with the 3 borders, 3 surfaces, apex and base, right? And then coming to the external features of the heart, this right atrium, it is separated from the right ventricle by a groove, which is known as the atrioventricular groove. It is also known as the coronary sulcus, where the right coronary artery runs. So this basically, if we move the heart, it also goes posteriorly, right? Then similarly the left atrium and the left ventricle, it is also separated by this groove, atrioventricular groove, right? Then these 2 ventricles, they are separated from each other by a groove, which is known as the interventricular groove, which is present on the anterior surface, and similarly on the posterior surface, right? So this is the posterior interventricular groove and this is the anterior interventricular groove. Similarly, the two atria, the right and left atrium, they are separated from each other by the interatrial groove or interatrial septum. So these two, we cannot appreciate that anteriorly because of the presence of these vessels, but faintly posteriorly we can appreciate this interatrial groove, right? And then if we talk about particularly this right atrium, it has we can see that the atrium, it has got openings of the superior vena cava which opens into the right atrium and the inferior vena cava that again opens into the right atrium. And then there is another faintly groove or marking is present, which is along the right border. This vertical groove is called as the sulcus terminalis. This is basically formed by in the inner portion of the right atrium. Two parts are present, the smooth and rough part, which is separated by crista terminalis. So this crista terminalis, it basically produces this sulcus terminalis anteriorly, and on the sulcus terminalis it has got the SA node over here. We cannot see an SA node but here is the location of the SA node, right? And then this is the left ear-like projection of the left atrium, which is known as the left auricle. And if we see the vessels, we know that on the right side of the heart there is deoxygenated blood coming from the whole body via the superior vena cava and the inferior vena cava, which opens or which drains into the right atrium, and from the right atrium it goes into the right ventricle, and then from the right ventricle it goes into the pulmonary trunk and via the pulmonary trunk to the lungs. So this is known as the pulmonary circulation. So this is the pulmonary trunk coming out from the ventricle. Similarly, if we talk about the systemic circulation from the lungs, the oxygenated blood comes via these four pulmonary veins which opens into the this is the left atrium. It opens into the left atrium, and from left atrium it goes into the left ventricle, and from left ventricle blood goes into the aorta, the ascending aorta. So this is the ascending aorta. It continues to become the arch of aorta. From the arch of aorta arises the arteries, three branches: the brachiocephalic artery, left common carotid artery, and the left subclavian artery, and then it continues to become the descending aorta. So this is the external feature of the heart.